Hello! Welcome to this video learning program. In this occasion, we are going to learn English conversation for midwifery. Today's topic is about health education about the danger signs during the third trimester of pregnancy. What are some late pregnancy danger signs and symptoms to look out for? Late pregnancy comes with the risk of some serious complications. What are the danger signs during the third trimester of pregnancy? They are preeclampsia, less baby movement, vaginal bleeding, and premature rupture of membrane. If pregnant women experience any signs of the symptoms, they are expected to call healthcare provider or visit hospital as soon as possible. We encourage you to practice and repeat after what the speakers say in the conversation. You can act as a midwife and ask for help from your partner to act as a patient after this video has ended. You can also restart and keep repeating the conversation video from the beginning until you are satisfied and excited with your own English skill. Then, without any further, let's get it started.
Good morning, Miss.
Good morning, Mrs. Rina. How do you feel today? What seems to be the problem?
I've been suffering from a headache these days, Miss.
How long have you had this headache?
I think it started about 3 days ago, Miss.
Can you tell me more about the pain? Is it stopping you from doing normal activities?
It's been 3 days, but still painful for me. So, I can only stay in bed lately.
Do you have any other problem aside from your headache? Like vision changes maybe?
Vision changes? I don't think so, but I've been experiencing heartburn instead.
You have heartburn. I see. That must be uncomfortable for you.
Yes, it's very uncomfortable. I can barely eat much because of it. Is that normal, Miss?
You don't need to worry. The symptoms you told me earlier are quite common when you reach third trimester of your pregnancy. You should get lots of rest. Drink plenty of water or juice would be helpful. If it is too painful, I will prescribe medicine to relieve your headache.
Thank you, Miss.
Ma'am, you just mentioned about heartburn, right? It can be caused by the growing baby is pressing against your stomach, and that is normal. Or it can be caused by acid indigestion as well. It's not harmful and usually goes away after giving birth. Do you feel any pain around your neck?
Yes, I have a sore throat and it's kind of hard around my neck.
That happens since heartburn can radiate the pain to the neck and throat. It gets worse if you lay down or bend over after eating. Try to maintain proper posture for 1 to 3 hours after eating something to prevent heartburn.
I often feel shortness of breath after eating, so I tend to lay down after that. Now I know that's bad for me, I'll try to change that habit.
That's good. You need to avoid eating spicy, greasy food as well as drinking coffee or carbonated drink. Anything that can irritate your stomach. Eating papaya or pineapple will help you digest better. Slowly eat your food to prevent the increasement of gastric pressure in your stomach.
Alright, I'll try to do that, miss.
Then I will add some medicine and vitamins for your heartburn.
I would appreciate that, miss.
The third trimester is the hardest stage of pregnancy. In the future, you may experience more health problems, and it might be dangerous if the symptoms are not identified.
What kind of danger, miss?
Have you heard or been consulted about complications in third trimester of pregnancy?
I've heard about preeclampsia from my friend. She said I need to be careful of getting preeclampsia since it's very dangerous for me and my baby.
Yes, that's right. But preeclampsia is not the only one you need to be aware of. There are also other complications like vaginal bleeding, decreased fetal movements, and premature rupture of membrane.
Please tell me more about it, miss. I'd like to be informed about all those symptoms.
Then let's start from preeclampsia. Preeclampsia is very dangerous. It can happen in the late pregnancy, during labor, or in a few days after a woman has a baby. The symptoms are when you are experiencing vision changes, strong headache, pain in the top of belly, or swelling on your face and hand area. These symptoms can lead to convulsions and even death for both mother and infant.
That's why you asked me whether I had vision changes or not. It's one of the symptoms.
Right. I wanted to make sure you don't have it. But based on your symptoms, I can conclude that you don't have preeclampsia.
Alhamdulillah, that's good to hear, miss.
I understand your feeling, Mrs. Rina. Actually, there is nothing to worry about. Let me continue. Other symptoms can be decreased infant movement. As you know, the mother usually feels regular kicks every day by the 6th or 7th month of pregnancy. If the baby stops kicking for a few hours, it's still fine. But if you can feel 10 movements within 12 hours, you should contact the healthcare provider immediately for help, because that indicates something is wrong with your baby's condition.
Okay, I'll keep that in mind.
And the next one is vaginal bleeding. It's still considered normal to have vaginal bleeding when it is light or just spotting. But there are also dangerous vaginal bleeding in pregnancy. This bleeding can be associated with or without pain. There is placental abruption, vaginal bleeding with pain. The bleeding happens when placenta detaches from the inner wall of the womb before delivery. While placenta previa is vaginal bleeding with no pain. It happens when placenta is covering the cervix instead of being near the top of the womb. Both placental abruption and placenta previa are very dangerous. It can cause you hemorrhagic shock, also threatening your life. And then there is also premature rupture of membrane. It happens when rupture breaking open the membranes before the labor begins. The symptoms include a feeling of wetness due to leaking of fluid from your vagina, usually caused by infection in uterus. It will be dangerous for mother and baby if it develops serious infection. If you experience any symptoms I've said earlier, you should call a healthcare provider or midwife right away, even if it's after hours. In that case, the doctor or midwife can help you to figure out next steps based on your symptoms.
Okay, I understand, Miss.
So far, do you have any questions, Mrs. Rina?
No, Miss, I think I'm good.
Well, then let me see if you understood correctly. Can you please tell me again the danger signs I've said to you earlier?
Yes, sure. So, there are preeclampsia, decreased infant movement, vaginal bleeding. Also, there is premature rupture of membrane. Am I correct, Miss?
Yes, that's excellent, Mrs. Rina. Alright then. Get well soon, and don't forget to take plenty of rest. Take care of your health. And the medicine I've prescribed for your headache and heartburn. You can stop taking the medication if you are already feeling much better. But for vitamins, you should finish them all. Alright, ma'am?
Okay, I understand, Miss.
Before we end up this video learning program, let's have a look and practice again by repeating several important sentences that we have heard earlier. You will hear the speaker repeat several sentences and conversation each twice. There will be a transcript and gaps in the audio for you to speak in. Listen and repeat after the speaker at the second time to practice. Let's start. How long have you had this headache? How long have you had this headache? Is it stopping you from doing normal activities? Is it stopping you from doing normal activities? Do you have any other problems aside from your headache? Do you have any other problems aside from your headache? If it is too painful, I will prescribe medicine to relieve your headache. If it is too painful, I will prescribe medicine to relieve your headache. Have you heard or been consulted about complications in the third trimester of pregnancy? Have you heard or been consulted about complications in the third trimester of pregnancy? You should call healthcare provider or midwife right away, even if it's after hours. You should call healthcare provider or midwife right away, even if it's after hours. Get well soon and don't forget to take plenty of rest. Get well soon and don't forget to take plenty of rest. In the last part of this video learning program, you have learned about English and health education about danger signs in third trimester of pregnancy. Don't forget to keep practicing it with your partner, so you'll be able to speak regarding this topic in English more confidently. We will meet again in the next video learning program. See you and good luck!